What are your thoughts on pregnancy and chiropractic care?
Actually, this is one of the most common things that people ask me about. A lot of times I'll get calls from pregnant women, and they'll say, hey, is it safe for me to have chiropractic while I'm pregnant? And I'll say, yeah, it's definitely safe. In fact, it's encouraged because a lot of the recent research has kind of suggested that around 80% of women are going to have some pain with pregnancy, whether it's back pain or sacrum pain. A lot of them will be affected by it, whether it's just the changes that are going on. You're putting on 30 or 40 pounds. Sometimes that can actually lead to a lot of pain. So I do I'd say about 10% of my practice is prenatal or even infant care, which is really cool too.
How can chiropractic care prepare for the actual delivery of the child?
Actually, that's a really good question because some more research has shown that with chiropractic care during the pregnancy and during the entire 9 months of it, labor times are down about 20 to 25%. So it can actually decrease the amount of time that it takes for the patient to have the child.
I heard that the natural childbirth process can be traumatic for an infant. How does chiropractics help that?
Yeah, when a child is in the birth canal for an extended period of time, whether it takes, some births go really quick, others can take a long period of time, and so the mother's kind of having to push for multiple hours, that's actually pretty traumatic on a child. And it's not really a fragile process. I've witnessed a couple myself, so I do have 2 children, and I get to kind of help along with that, so it's been kind of cool. But yeah, so when the infant comes out, they're a little bit beat up sometimes. And so I've seen anywhere from a 1-day-old up until about 2-3 weeks. That's usually the first time in which patients will bring in their children to have their first adjustment. And so a lot of what it does, though, is it helps with some of the ligaments that can tend to be a little bit stretched because the baby does not have much room inside of the womb. So a lot of times they're cramped up anyway, and it helps to just kind of stretch things out, get things moving. It can help with things like colic. Sometimes babies will be naturally just more prone to being colicky and gassy and fussy. And a lot of times some of the research has shown that it helps with that as well.
What are some other health conditions for children that chiropractic care can help with?
Yeah, there's a variety of different things that I see quite frequently, one being frequent ear infections. A lot of times when things become static, that means they're not moving around. The top of the neck becomes a major area in which if we work on that in a lot of children, we notice a deep decline in the amount of ear infections that they have. There's also other things. There's some research, although some may be a little bit foggy, about kids in bedwetting. I've adjusted some children at times and through early to late adolescence that have then had good results, and they've decreased the amount of bedwetting that they've done.
What do you think is the most unique aspect of your practice?
I think it's mostly just the variability in the things that we do here. We treat a variety of different patients, different conditions. I've seen, again, anywhere from 1 day old all the way up to 103 years old here. And I also like to do sports-related treatments. I've worked with some of the local high schools around here in that. And so, we do nutrition as well. We have a couple of massage therapists that do a very good job. So there's a lot that we actually do here.
If people would like to learn more information about your practice, where do they do that?
Sure, yeah. I'm a firm believer in you can just talk to me, stop by and see me. I do a lot of community events too, as well as if you just want to get online on www.hillmanwalkinchiropractic.com.
Thank you so much for your time.
Thank you.
I'm Kate Winzeler reporting for ABEX Community News.